now, let's welcome Dr. Stephen Nunns of Novant Health, OBGYN. Welcome back, Dr. Nunns.
Oh, thank you. It's good to be here.
It's a pleasure to have you back on the show. What have you been doing?
Well, I've been getting settled at the practice. You know, I started back in August of last year.
Yeah.
It's been a little bit of an adjustment, but it's been fantastic. I couldn't be happier anywhere else.
Oh, that's great to hear. Well, there may be some people out there who haven't really met you yet, so tell me a little bit about your education and your background.
Sure. So I was actually born right here in North Carolina in the Fort Bragg area.
Oh, that's right. I forgot that.
Yeah, and I went to Wilmington for undergraduate school, then actually went to Greenville at the Brody School of Medicine for medical school, and then back to Wilmington for residency. And then when I completed residency, I decided to stick around close by, and now I'm here.
That's awesome. Yeah, we get a lot of residents from New Hanover. That's worked out well for us.
Pretty much every OBGYN that's there, yeah.
I know. And so you're enjoying the area so far?
Oh, yeah,
Of course,
absolutely.
you were here for your residency, so.
Yeah, but that got me very familiar with the patient population that I'm treating here, and it's a population I know very well, and I feel comfortable taking care of them.
Yeah, awesome. Well, tell me a little bit about Novant Health OBGYN.
Yeah, sure. So it's the primary OBGYN provider for Brunswick County and a lot of the surrounding areas. We've recently acquired New Hanover as well, so we're really the largest game in town. There's 8 providers. There's me, and there's 4 other physicians, 1 midwife, and 2 nurse practitioners, and we run the whole range of women's health care.
And you have several locations, right?
Yes, we do. Our primary location is in Bolivia near the hospital,
Right.
but we also have locations in Calabash and Southport. And we've recently started to increase our presence in the Leland area as well, where I'm there once a week and my partners are there usually once a week as well.
Oh, nice. And you provide both maternity and gynecologic services, is that correct?
Absolutely, and it runs a large range. So we go from, as far as obstetrical care, we have midwifery care. Our fantastic midwife, Kia Fox, provides a lot of that. Along with me and my partners, we provide more traditional OBGYN care. And then we have advanced GYN solutions with the Da Vinci robotic system, which can range from normal routine care versus more advanced surgical options.
Yeah. Well, I know that people in the community, women, have been putting off some of their yearly checkups and what have you due to COVID. So is this something that you're noticing in your care for your patients? Have they been putting off their treatments?
Absolutely, and understandably so. I think
Right.
COVID was very scary for a lot of patients. A lot of people didn't want to leave their house for the most part, and I think at some degree that was a very responsible decision. So I am seeing a lot of patients who are sort of coming back into the fold, having missed their annual exam last year, which is okay for the most part, but it's important to get back to regular standard checkups as quickly as possible.
Well, tell me a little bit about annual GYN visit and why that's important not to skip those patients.
Sure, absolutely. So at your annual visit, it's more like a routine health check where we go over all of your previous medical, surgical history. We try and screen for certain symptoms that might be troublesome that you might not even realize there's an issue. The whole point of it is preventative medicine. My mom used to have a saying that an ounce of prevention is worth a pound of cure, and I think it's absolutely true. And so especially at a GYN visit, how it differs from maybe a normal primary care visit is we sort of handle the pap smears, which in my opinion is probably the greatest screening tool that's ever been invented in medicine. It literally reduces cervical cancer tremendously. So as long as you're getting those on a regular basis, you're going to be in pretty good hands and have good care that's going to help prevent some possibly really detrimental problems down the line.
I also see that women are delaying their mammograms, and as well as lots of other tests. Do you have any words of encouragement for women who have been putting off their mammograms, for instance?
Yeah, absolutely. So again, I think it's normal, or it's been a reasonable decision that you might have put it off for a little while, being in the COVID times. However, I think it's time to come back and get the routine
yearly
screenings
mammograms.
done. Exactly. And everything is set up in such a way that we're trying to maintain a good, safe area to provide care, and we've done a good job, and I think you should come on back.
Well, let's talk a little bit about those safety measures. In your office, in the OBGYN office, what precautions are you taking to make sure that your patients are safe?
Yeah, absolutely. So every patient, when they get seen, they are asked a series of screening questions to make sure that they are not at higher risk for actually having an infection. And if they have potential concerns or symptoms, then we have them rescheduled, or we do things through televisits over the phone. And then the staff themselves, the majority of them have been vaccinated at this point. We also maintain wearing masks and all those other sort of routine strategies to help prevent the spread of COVID virus.
How about the chairs and the way they're set up? Are they separated?
Yes. So they are separated, so everybody's hopefully at least 6 feet apart. The chairs are cleaned along with our regular equipment in our rooms to make sure that if there is some sort of virus there, it is eliminated before the next patient can come into contact with it.
And I think the chairs have green.
Yes, that's how we identify which chairs are clean and which ones are dirty or which ones need to be cleaned.
Because I see green ties everywhere in all the practices.
That was actually one of my first questions when I arrived here. What does the green mean?
Well, let's talk about scheduling. How about online scheduling? Can you schedule appointments online through MyChart?
Yes, you absolutely can. In fact, it's a very easy process once you're signed up to MyChart. And that's just good in general, simply because MyChart's going to give you access to labs. It's going to give you an easy way to communicate with us and read your result notes and stay more in touch with your own health care. So yes, you can do that through MyChart and come see us that way, but you can also give us a call. Our primary number is 910-720-4050. We'll be happy to take any phone calls you have. Oh, sorry, 721-4050. We're happy to take any calls and schedule you over the phone.
And I don't think you need a referral for an OBGYN, is that correct? No,
we establish a lot of primary care with our patients, so you don't necessarily need to be referred. However, if you have a primary care physician who has an issue that that they would like you to be seen by us for, that can also be another avenue for you to get in touch with us and establish care.
I want to touch on the mammograms for one thing with the COVID vaccine. I understand there are some restrictions or
Yes, I know exactly what you're touching on. So it is something that we have seen where if you have just recently received a vaccine, the vaccine is designed to cause an immune response. And one of the things that happens in an immune response is sometimes your lymph nodes can be a little bit swollen. So when you have a mammogram that picks up on those enlarged lymph nodes, that's technically also a sign that could potentially be an indicator of a possible breast abnormality, such as a breast cancer and that sort of thing. So we are encouraging people to distance themselves from the time they get the vaccine to actually getting the mammogram, just to avoid that sort of false positive and then the stress and the anxiety that comes along with it.
You know.
Absolutely. Yeah, it's a very easy thing. You just give it a couple of weeks to a month in between, and usually that's enough time for that immune response to resolve.
Okay, so a couple weeks afterward, you should be clear and
Absolutely.
you can go ahead and have your mammogram then.
Absolutely, a couple weeks after your last injection.
Yes,
if you're doing
if you have the two vaccines.
Yeah.
And are you taking new patients?
I sure am. I think as the youngest member in the physician group right now, I have the most openings.
Of the group,
I'm the baby of the group, absolutely. I have the most openings, so you'll be able to get seen by me sooner. All you have to do is call and make an appointment or go through MyChart like we mentioned earlier.
Great. Well, thank you so much for being on with us today. It was a pleasure to have you back, and I look forward to having you again in the future.
Anytime, June. I really enjoy these.
Great. Thanks so much.
Absolutely.